From the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. Welcome to Medical Monday. Another great topic for you. I know we are going to learn a lot over the next hour. And as always, we are taking your calls. The topic tonight, non-surgical facial rejuvenation. I got that topic and I said, well, what is that? Well, we're going to learn what it is. We have Dr. Dan Hatef here with us tonight. Good evening. Thank you for joining us.
Thank you. Good evening. Thank you for having me on.
Okay, first let's just get the who, what, when, where out of the way. Tell us about your practice. What's the name of it? Where are you located? What do you do?
So it's Dan Hatef, MD. I'm located in Midtown in the hospital district. I do plastic surgery, head to toe cosmetic surgery. I do a lot of in-office facial fillers, Botox, minimally invasive lasers. I do a lot of liposuction and rhinoplasty in the hospital. I also share office space with Dr. Pat Whitworth, who's a world-renowned breast cancer surgeon, and I'm honored to help him with his breast reconstruction.
So very important. I know for women who have had breast cancer, that is a big step along their journey to get the reconstruction done and to have a good job done. You know, I mean, they've gone through so much.
Oh, yeah. It's a huge honor to participate in their care, and Dr. Whitworth and the breast surgeons in town entrusting their patients to my care is really a huge honor. And not only that, but it makes me such a better cosmetic surgeon of the breast to really know how to use implants, know how to use fat grafting. It really is synergistic.
That is amazing work you do, but tonight we're going to talk about facial rejuvenation. And if you have a call, go ahead and get those calls lined up. Taylor's in the back to take them and give me the names. Numbers on the screen, 615-737-PLUS is the number to call. So let's just start with, what is facial rejuvenation?
So facial rejuvenation is the reversal of facial aging. Facial aging begins as soon as we're born, and patients as young as their 20s are now coming in for Botox and minimally invasive lasers. Fillers, I reserve this for patients who are in their 30s and 40s. You know, about 5 years ago, the so-called mini facelift was coming into vogue, and people were doing it a lot. Now I have not done a mini facelift in about 2 years.
Really?
And the reason is because the fillers and the Botox give us such a nice result that I can get you halfway to where you want to be without doing any surgery. So I actually do more full facelifts now than ever, but I also do zero mini facelifts because you can get a mini facelift with fillers and Botox.
Okay, let's talk about this, I guess, the stereotypes of plastic surgery. And we all know, and we've all done it, when somebody walks in the room or you see a star pop up on the TV screen that you haven't seen in a while, and you go, whoa, what did they do? And that's probably like the worst of your field, right? You don't want people to say that. But things have evolved. There's been an ebb and flow over the decades with plastic surgery, right?
For sure. So, you know, 10 years ago, you would see a lot of poor results from facelifts, overcorrection. And so when fat grafting and fillers started to come into vogue about 5 to 10 years ago, we thought, we're done with the terrible facelift results. Now we're going to get great results because everything's going to look natural. We're going to revolumize the face. The face is deflated and it needs to be inflated. And that's true to some extent. But now we're going overboard with the fillers, and that is causing these overfilled, puffy looks. And so a combination of the two is often good. I talk about restoring youthful tension. If you look at someone from the time that they're, say, 55, I'll have a patient bring in a picture of themselves 20 years ago, and you look at them when they were 30 or 35, their face is just more tense. If you look at models on TV, their soft tissues are under tension, their dermis is under tension, and so that creates a very convex surface which reflects light, and that tells our brain that's a youthful face. So when you age, your fat does deflate, that's true, your skin does loses elasticity, that's true, but really what it is the loss of that youthful tension. So you want to do precise facial filling. You've got to know the anatomy. You've got to know about the fat compartments of the face, which I helped uncover when I was in Dallas. We did some amazing anatomical research, took apart faces for 3 years, and really rediscovered the anatomy of the face. And if you know that anatomy, if you know just put a little here, a little there, you can really restore what someone looked like about 5 to 7 years ago.
I want to dig into all of that because I think it's fascinating. But before we get to that, because I don't want to forget to ask this question, for folks who are watching, like, thank goodness I'm decades away or years away from, you know, thinking about a facelift, how can you preserve your youthful look when you're still young and ward off those wrinkles and aging effects?
So Best thing to start is good skincare, because beauty is skin deep. You've got to be on a good skincare regimen, and I think that needs to start when you're a teenager. When those hormones kick in and acne starts, that's when you start your skincare regimen. And it changes at every stage of life. And if you have a good skincare regimen, that will really help. Always wear sunscreen or sunblock. Melanoma is a killer skin cancer. So I cannot emphasize enough, you've got to wear sunblock, strong sunscreen, SPF of at least 50, good moisturizer. Really minimize your risk for skin cancer. And when you're doing that to not get cancer, you're going to take care of your skin to where you don't get sun damage, you don't get the melasma, you don't get the fine lines and wrinkles as quickly. So you're putting off that facelift, you're making what I do easier.
And when you say good skincare, what kind of, there are millions of products out there. We are being marketed from our friends to these days. How do you know what is legitimately good?
So there are a lot of products on the market, and in my opinion, you need to change them out every season. Just like when you use something in your hair, you know your hair gets used to it. Your body gets used to products. So one thing I would say is you're not going to have the same regimen for 5 years straight.
Okay.
Get with a good board-certified plastic surgeon, board-certified dermatologist, and let them quarterback your skincare so that they can tailor it to your specific needs, because your needs are going to change as you age, as the seasons change. If you have a breakout, allergic reactions, you need someone quarterbacking your care, and you want a good esthetician and a good plastic surgeon or dermatologist quarterbacking that care.
Okay, let's jump into the office visit. If I come in and say, I'm just looking a little haggard, looking a little older than I want to look, where do you start?
Well, I don't think I'd start with you. I'd wait a good 5 or 10 years.
But 5 or 10? No, okay, I'll take it. I'll take that as a compliment. But where do you start with folks?
So definitely start superficially. So analyze their skin, see what kind of skin type they have. Is it oily or dry? What's the level of sun damage? Are you going to benefit just from a good skincare regimen? Some people just need a good skincare regimen. Some people need more. So if you have fine lines around your eyes, if you have the glabellar frown lines, if you have the forehead rhytids that so many people hate, then I'm going to start talking to you about Botox. Botox is going to weaken those muscles. I don't like to paralyze the muscles because it can give a weird look. It can weaken the muscles over time. So you just want to start out with a splash of Botox here and there, really decrease those fine lines. If you're lacking a little bit of volume, and you can start with a syringe or two of filler. That's not really what I'm talking about when I say the mini facelift with a filler. For that, you really need 4 to 8 syringes of filler. When you're starting out, one filler, just filling in these fine lines, is perfect.
Okay. And so really just a little shot here, a little shot there, right?
That's exactly right.
That's all it takes. And what exactly happens? What does this filler do? I mean, I assume it fills something. And then how long does it last?
So that's a great question. So we're getting much better with facial fillers, both as doctors and the manufacturers. So we have fillers now that last 2 to 5 years. How long it lasts depends on where you put it in the face. So around the mouth, you're talking all the time, you're eating. That's not going to last as long. The filler's going to be moved around and metabolized more quickly. If you put it in the cheeks, lasts longer. Temples lasts not quite as long because you're always chewing that temporalis muscles, wearing it down. So it depends on where you put it in the face. It's really key to go to someone who understands the facial anatomy. I think nurse injectors are great. They often do a very good job. I'm a plastic surgeon injector. I see those muscles in the operating room every day. I've seen the facial fat compartments. There's nothing like someone who has that level of understanding and experience. So
you might choose different spots to inject than maybe somebody else? Is that what you're saying?
I do, yeah. When patients come to me, either they're not happy with where they're being cared for currently, or they want to try something new, they tell me I do a lot more shots and a lot less in each place. So I think that people are injecting a lot with each shot, and cannula use is becoming very popular. I use a cannula sparingly. The cannula has this role. So typically we injected fillers with a sharp needle, and so people theorized, well, if we do the filling with a blunt instrument, there'll be less bruising. It's kind of true.
Okay.
But the problem is that you can't be as precise with a cannula. So when I'm doing depot injections where you can inject deep into the face and you need to inject a larger amount, I think the cannula is great. But you need to have the ability to inject multiple times in multiple different areas and also multiple layers. So in the lips, I really like to use 2 different kinds of filler. One is a little bit more viscous and it just fills in like water, fills in the fine lines, but there's no structure to it. So you can't really define these filter columns nicely. You can't define the shape of the lips as well. Another thing about filling the lips is you've got to fill the lower lip more than the upper lip. A lot of times when people say, oh, she has sausage lips, or they don't like her lips, really carefully look at it. You'll see typically the upper lip is the same height as the lower lip, and there's the same fullness. That looks unnatural. The brain knows that's not normal. So you need to fill that lower lip a little bit more.
Very interesting.
Oftentimes patients come to me to get their fillers melted. I can actually melt fillers. I'm very accurate at doing it. So when they come to me to get their fillers melted, oftentimes what I tell them is, it's not that you need your filler melted, you need fillers in other places. So sometimes patients will think that they have sausage lips, and I'll put a little bit of the melting agent in their upper lip and a little bit of filler in their lower lip, and that balances out nicely.
Very interesting. Okay, we're already learning a lot. We're going to have to take another quick break, or our first quick break, I should say. If you have a question, now is the time to call 615-737-PLUS. We're talking about plastic surgery tonight. Stay with us.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. Now, you may be new to the area, but we're not. We've been building the Kennedy Law Firm for over 3 decades. And if you've been injured, call us today. That's 931-645-9900.
Whether a house is new or whether a house is 20 years old, we can go in and we can find debris in the lines. Mr. B's is about doing duct cleaning the best that we can do it and better than anybody else in the industry. That's what I personally stand behind and guarantee. We never make a claim that we're going to help your health. That's just something we don't do. But again, I personally believe that if I put you in a cleaner environment, it's got to have a positive impact on you. And we literally cut a hole into the main trunk line. That's the main artery, just like a tree trunk. And we attach a HEPA vacuum system to it.
All right.
When we do that and turn it on, it causes a negative airflow. As that machine's sucking everything backwards, we go to each line and we'll brush it, and then we air sweep it down to the trunk line. So we've taken everything back to that negative airflow. So again, whether it's upstairs or downstairs, you saw that everything is being brushed and air swept to the trunk line, not bringing it back into your breathing atmosphere. What makes my home need an air duct cleaning? You have to make that decision. It's your environment. And so if you have black lines at the edge of your carpets, or you have any sort of dust, excess dust in your home that you're dealing with, and that's a problem for you, then you definitely would want your air ducts cleaned. But most people understand, too, that if they'll just look down the return, take the filter out a little bit and look down the return, they'll see all the dust that they're breathing on an everyday basis. The way we do the cleaning, most residential homes will be good for 5 to 7 years. We do recommend that you have your system serviced by a licensed contractor and also use a good filter. We've been doing this for over 17 years now. We take pride in the fact that we have an A+ rating at the Better Business Bureau. Also the fact that we don't believe that anybody's going to out-clean us. And as I've said before, people can outprice me, but they're not going to out-clean me. There's only one way, and that's the right way, and that's what we do at Mr. B's Air Duct Cleaning.
This week on Fishin' Affliction TV.
Oh my goodness, what a fish. That's a killer fish right there.
Join Team Fishin' Affliction as they're on American Sport Fish's secret lake trying to catch a tiger by the tail.
That's a tiger bass right there, and a good one. Man, a good one.
Your Fishin' Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishin' Affliction time for those who've got it bad.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm. And if you've been injured, you need someone to go to court with you. We are honored to stand up beside you and to stand up for you. Call the Kennedy Law Firm, 931-645-9900.
Welcome back to Medical Monday. Tonight we are talking about plastic surgery, and in particular, things that you can do with your face to restore that youthful look that so many of us want. Let's face it, nobody wants to get older, I don't think. Dr. Dan Hatef is here with us tonight. Thank you for being here once again.
Thank you.
We're getting our calls lined up. In the meantime, I want to look at some of your before and afters. I think people always enjoy this, whether it's looking at a magazine or on a website.
Yeah.
So we have a couple of different chin, I guess, procedures you've done.
Yeah.
So what is the official name of this? And tell me what you did with these patients. These are your patients, the befores and afters we're going to look at.
So I'm really not aggressive about showing before and afters. I show people in the office, but I don't have any on my website. And the reason is because Nashville is such an industry town. Patient privacy is so important, and so you got to respect that. So I really, first of all, want to thank all the patients that allowed me to use their pictures.
Absolutely. Okay, so let's talk about this lovely lady.
So this patient is a 30-year-old female who was unsatisfied with the appearance of her chin and her neck, and so she saw another plastic surgeon who recommended a chin implant. I love chin implants. They have their place, but this patient has a poorly defined crease right here, and she has a small chin that a chin implant is going to blunt that crease. It's not going to look natural. She also has very delicate features, and chin implants, they look good in people with stronger features, sharp features, not in a person with delicate features. So she thought about it, didn't really want surgery, found her way to me, and I talked to her about using fillers. So in her, I used 2 cc's of Juvederm in her chin, and then in her neck, we used Kybella. So Kybella is a new filler from Allergan that actually, it's a detergent. Literally, detergent.
Really?
Melts fat, it binds to fat particles, causes them to die, and in my hands, Kybella is great, but I've seen some real disasters with Kybella. I've had to do some very, very difficult neck rejuvenation cases that were from Kybella gone wrong.
Well, what goes wrong? I mean...
So, Kybella was sold to us as doctors as no downtime, kind of like the fillers and the Botox. That's not true. You really, because of the inflammatory effect of the detergent, which is what melts the fat, you have swelling for 3 to 7 days. And so when it swells, if you don't compress it, that expands out the skin. So then you have this patient who has this cavitated fat and lacks skin, and often it doesn't look good, so then they'll go back and they'll go back and they'll do it over and over again. And you do have to do Kybella a couple times, but you can cause some real problems if you don't treat it right. So I put patients in a chin strap, compression. I tell them this, you're not really neck liposuction, not a neck lift, but you still have downtime.
You still need to take that into consideration.
Sure.
And then we were on that video looking at the pictures when you said this patient didn't have the crease right here, which I think once we show that to people, they understand. So that was your concern about the chin implant.
Yeah, and just delicate features in general. You know, having an artistic background helps as a plastic surgeon because you really take into account the whole facial gestalt. You've got to look at every aspect of the face, the age of the patient, what their soft tissues are going to look like after you put in an implant. You know, the body forms a capsular wall of scar around any implant, and that capsule will tend to contract over time. So in the face, that's fine if you use it in the right patient. You can actually use that to your advantage. But in a patient with delicate features, they can look really bizarre.
Let's take a look at the next before and after we have. It's another chin operation, or a chin, I shouldn't say operation, that chin procedure is what you did. Here's another young woman.
Yeah, so again, patient who was told she needed a chin implant, not happy with the idea of having that done, doesn't like her neck. She is actually a patient who I recommended not doing Kybella because I felt like she would need a lot of treatments. The patient before had a little bit of fat in the submental fat compartment of the neck, which I helped describe. This patient has a lot more, and she has fat beyond the submental fat compartment boundaries, which is where you want to inject Kybella. So I recommend that we do in-office liposuction and do some filler to the chin. Again, 2 cc's, Juvederm, liposuction to the neck. Very good patient, cooperated with the neck compression. That's a really bad thing about liposuction in the neck. You have to wear the chin strap for 3 weeks, or else you're not going to get a nice result. And she did, and so she has a really nice result.
It's paying off now. Let's jump to the phones. As we always do, we promise to try to get as many calls as we can, and we have Brittany on the line. Hi, Brittany.
Hey, thank you for taking my call.
You're welcome. Go ahead with your question.
I was wanting to know if it's safe to continue Botox during my pregnancy, or if there's other safer procedures that are recommended.
Okay, great question. What do you say?
Brittany, thank you for your question. Botox is probably safe. Fillers are probably safe during pregnancy, but just the possibility of causing problems, I don't do it for patient safety, for both for the mother and the child. It's such a small amount that probably doesn't get into the arteries. I think there's probably no issue with it. I don't do it in my practice. What I do for patients when they're pregnant is I use laser genesis. Laser genesis is a low wavelength non-invasive laser. It doesn't kill tissue. You form a little bit of collagen each time. If you do it very diligently every month, you're going to have a nice youthful glow. Those lines will be less. You'll look 2 or 3 years younger. It can also help with the melasma that you see during pregnancy, the pregnancy mask. Another thing that's good for that is IPL. IPL is the same. It doesn't destroy tissue. I don't do ablative lasers during pregnancy. The reason is if you get an infection, you have to take the medicine. The infection could hurt the baby. The medicines that you have to take could hurt the baby, especially just to avoid all that. Now, after pregnancy, you can do all these things, and oftentimes patients come to me and they say, I like the way I looked during pregnancy. Why is that? Because you're retaining that fluid, so your skin, your fascia, the soft tissues are under that youthful tension, and so they like that.
That's the pregnancy glow,
yeah,
probably,
the pregnancy
right?
glow. That's exactly right. So I will use fillers to regain that appearance.
Huh. Great question, Brittany. Thank you for asking it. We appreciate it. Let's jump to Nancy. Hi, Nancy.
Hi.
Hi. Go ahead with your question.
Thank you. My question for the doctor is this. I have a fairly youthful face for 54, but I do have marionette lines. They're not severe, but they're noticeable, and that's very much an age-detracting thing to my face. So how would the doctor recommend treating those?
Okay, first of all, what are marionette lines?
Nancy, that's a great question. So marionette lines are the lines that come down, and scientifically it's called the labiomandibular crease. It comes from the corner of the mouth down to the jowl, and it's caused by the insertion of the depressor anguli oris muscle. The best way to correct it, facelift. But most patients don't want a facelift, especially listening to Nancy. She still looks youthful at 54. She probably doesn't need a facelift just to fill this in. I do two things. I use filler to fill in the crease, and then there's a new filler. It's from Allergan. No disclosures. I don't own any Allergan stock. And it's really good for getting those superficial creases better. That's not enough, though. Part of what it is the action of the depressor anguli oris muscle. So I'll inject a little bit of Botox, 2 splashes in each side, and it really helps take care of that.
So it's really a multidimensional approach. And it sounds like to a lot of the things that you do, you want to kind of spread it out, spread the love a little bit.
Yeah, a lot of a little bit really helps.
So how often is she going to have to do this sort of thing, though?
So the velour that I was talking about from Allergan, that should last 2 years, probably in the mouth less.
Because of all the movement?
Yeah, because of all the movement. If you weaken depressor anguli oris, it'll last a little bit longer, but it's not going to last forever. She's going to have to do it every year. It's another good place for laser genesis. If you just really diligently come in once a month for laser genesis, I go to town on those lines. You'll look sunburned for a day, but it will really help.
Wow. Okay. I hope that helps, Nancy. Gives you some options at least. And by the way, we will be putting up Dr. Hatef's number and how to get a hold of him, email, web, whatever you want to do. So get a pen and paper handy. We'll be doing that a little bit later on in the show. Let's talk about this laser a little bit more. How does it work? What do you use it for? What can people expect downtime-wise? So
it's a low wavelength laser. It doesn't destroy tissue. It induces collagen formation. The wavelength of the laser gets into those melanocytes in the dermal cells and causes them to reproduce themselves. So it manipulates your cell's genetics to act like younger cells. It's really good if you do it over and over again. I do it every 2 or 3 weeks on myself, and it really helps keep my skin in shape. My wife feels the same way. And my patients that have the best results with the laser, they're diligent about coming in once a month. A lot of people before award shows, they'll come in for about 2 or 3 sessions right before, and it really just helps give that youthful glow. It doesn't necessarily fill in the creases, but the creases, their appearance is minimized because the tissues are under more tension, so you're retaining that soft tissue away from the creases. What does it cost? Laser genesis for a series of 4, it's $1,000. Okay. So for 4 months, $1,000 is really not that much when you think about what you spend on food and entertainment. What about, does it hurt? Laser genesis doesn't hurt. It's like a warm wave. It's pretty nice. Oh. Yeah. Now when it starts hurting, that's when you know to move on. But it's really well tolerated. IPL, IPL can hurt a little bit. My hands, put numbing cream on. I really make sure I take my time and use the cold handle to make you comfortable. But
what is the IPL?
So IPL is an intense pulse light. Intense pulse light or broad-based light is not like a laser. Laser is monochromatic, meaning one wavelength. IPL is multiple different wavelengths in one light, and that really helps take care of dyschromia, which is a fancy word for age spots.
Gotcha. Okay, we're going to take another quick break. Carol, I know that you're on the line. As soon as we come back, we will take your call. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
From News Channel 5, I'm Storm 5 meteorologist Henry Rothenberg. A few light showers as we go through the evening, but nothing that'll be problematic out there. The real threat coming after midnight and will be with us for the Tuesday morning commute in the form of some heavy showers and thunderstorms with a pretty strong cold front heading this way. You're looking at temperatures all across the region, and you can see that colder air. If you look to your left on the screen, you have got that colder air sliding this way, Arctic air that is, that's going to hang around for quite some time. Here are the current conditions out at the airport. This is updated every hour. For the forecast for tonight, 53. Now 55 will be the high on Tuesday, but that is going to be at midnight. Temperatures will fall as this front pushes through, and by Tuesday afternoon will only be in the 40s. Staying cold for much of the upcoming week, with highs in the upper 30s to around 40 and lows in the 20s and teens.
The guy who accidentally burned down his town. Next, Inside Edition. He was trying to recreate a stunt he saw on a TV show. What happened next? 30 buildings go up in flames. Downtown destroyed. Can he ever face his neighbors again? Then, a beauty queen takes center stage as she battles a life-threatening illness. Watch the next Inside Edition.
Tomorrow at 4:30 on News Channel 5. There is no single answer to securing your financial future. You need to look at it from every side. Get dependable advice you can count on every week with the Retirement Report on News Channel 5 Plus. Experts on finance, taxes, and the legal system are ready to answer your questions. Don't wait to make a plan for your money. The Retirement Report, Friday mornings at 8 and at these encore times on News Channel 5 Plus.
Dr. Dan Hatef joining us tonight for Medical Monday. Thank you for joining us as well. I promised we would get right to the lines. We're talking about plastic surgery, in particular facial plastic surgery, and also non-invasive procedures. So let's get to Carol. She's got a question for the doctor. Hi, Carol.
Hi, good evening. Thanks for taking my call.
You're welcome. Go ahead.
I was wondering if the doctor had any experience using Volbella as a tear trough filler, and if so, what was his thoughts on that, or are there other products that he prefers? Should I hang up to listen to the answer?
You can. You can hang up, and I'll just put you on hold, and you just turn up your TV now. Thanks for calling, Carol.
Thank you.
All right. Okay.
Carol, thanks for your call. Yeah, I've used Volbella. I think that Voluma is the best thing for the tear trough, actually. And it got a bad reputation when it first came out, Voluma. So there's a family of fillers from Allergan, Voluma, Volure, and Volbella. And I love all three of them. But I've really started to use Volure and Voluma exclusively just because they both work so well in their own way. The reason Voluma got a bad reputation is people were putting too much in the superficial aspects of the cheek, especially medially. And I've had people come to me complain that they feel like they look like a rabbit or they're too full next to their nose. And so, Carol, the thing to do is, I like Voluma, it's the best, but I can use any filler and really treat the tear trough. And the way you do that is you just fill a little bit in each fat compartment. And when I do that, I go essentially around the tear trough in a clockwise or counterclockwise manner, and that really helps volumize that area so that the orbicularis retaining ligament that's causing that appearance, it's lifted up, and it's not under the weight of the entire dermis of the cheek, so that muscle can relax. It gives a softer appearance.
I see that there's a nickname for all of these things.
There are,
What
yes.
is the teardrop, or what are we talking about?
The tear trough is this line that comes across here. People call it the lid cheek junction.
Yeah.
Even in our literature, you can open up a plastic surgery journal, and it'll be called 3 different things by 3 different authors. Malar crease, malar groove. I mean, there are many different.
So it's just when this area is very pronounced, like you just have a big crease right here?
So when people age, you see they have 2 elements to it. One medially is just a straight line, and then as you get out towards the outside of the eye, it comes up like this. And then something comes across their cheek here. And what these are from is from the fascial retaining system of the face. It's actually throughout our whole body. We have dermis in our skin. We almost have a little sheet of dermis deep to that underneath the superficial fat. And so it sends up septi into the skin, and that's what I was working on in Dallas. Really defining that facial skeleton and figuring out where do these things insert. How can we either cut them and move them or fill them? What's the best way to go about rejuvenating the face using that knowledge of facial anatomy?
All right, Carol, thank you very much for your call. We have Abigail on the line. Hi, Abigail.
Hi.
Hi, go ahead with your question.
Is there a difference between Botox and Dysport?
Abigail, that's a great question. I think I get that question about once a week. Dysport has become much more popular, and I use them both. They're basically the same thing. They're both botulinum toxin. They're just constituted a little bit differently. Dysport, you inject more units when you inject. It's about 2 to 3 per 1 unit of Botox. Basically the same price. The difference is Dysport's a little bit more painful. Dysport takes a little bit longer to kick in. And I feel like Dysport gives a little bit of a softer look. So when you come to me and you tell me your goals, if you say that you like people with their eyes really open, you like it when patients' brows peak, that tells me you want Botox. If you say you don't want to look like you've had anything done, you want to preserve the way you look, that's more of a Dysport patient. There's an age at which I won't use Dysport anymore because in some patients you really want to get a brow lift with the botulinum toxin using. In those patients, I generally use Botox. It's just a little bit stronger, a little bit of a harsher look, which in a younger person isn't your goal.
You mentioned something earlier.
And Abigail sounds pretty young. So
she does.
Abigail, I'm guessing you're a Dysport patient, but come in and see me.
And you mentioned something when you first mentioned Botox, that you were talking about starting when you're youthful, and we had a woman call in who wondering about when she's pregnant, she used Botox.
Yeah.
Is it better to start early, or does it matter?
I think so. So I'm a big fan of starting Botox and Dysport when you're younger, and obviously I'm financially incentivized to do that.
Sure.
But really, the more that those muscles act on your skin and on the retaining ligaments that I was describing, the more it's going to damage those. So if you start when you're young, and just a splash, you don't want to paralyze if you paralyze those muscles for 20 years, guess what? They're not going to move. So you don't want to do that. But splash here and there when you're younger, every 4 to 6 months, and then increasing in frequency, increasing in dosage as you get older. I think it's the way to go.
Let's say when you hit 40 and up, and I can say that now that I'm 40, I can say that when you hit 40 and up and not feel bad about it, how much does that frequency have to increase?
Well, I'm 41. I thought you were at least 5 years younger than me, so that's good for you. So with getting into your 40s, the thing about getting into your 40s is your lids, your upper eyelids start to get heavier.
Yeah.
You're reading all the time, you're working all the time. At the end of the day, you're feeling tired. When your eyelids start to get heavy, you start to use this muscle to lift them up. And so the problem with Botox and Dysport when you're in your 40s is if you weaken this muscle too much, your brow's going to drop. So I talk to patients extensively beforehand about this. When they don't like those forehead lines and they're about 43, 44 or older, I tell them, look, we can get rid of those lines, but your brows are going to come down. And sometimes we'll try it, hey, you just got to know that that's how it's going to be for a couple months. And we can kind of touch it up by injecting even more around the eyes, around the root of the nose, so that these muscles are even weaker, so that the frontalis muscle, which is a forehead muscle that makes those lines, frontalis, whatever action it has left in it, can take over. So I actually see some patients that feel like they were botched because their brows are so low. It's not that they were botched, it's just that they wanted those lines gone. Their nurse injector took care of those lines, but now their eyebrows are too low and they feel like they don't look youthful. So paralyzing those or weakening those muscles around the eyes can help get that back up. You got to be careful though, because you can start chasing your tail.
And I want to ask you about that too. When people come in, whether they want Botox or they want fillers or something, more advanced, is it realistic for someone to want to look like they did 20 years ago?
With a facelift, it is. With a facelift, it's realistic to turn back the clock. Maybe not 20 years, maybe more like 15 years. 20 years is a pretty aggressive goal, and I don't know if we're there yet. One of the things that you've got to realize is when you look at someone who's aged, part of what you see as a youthful face is the eyes. And there's nothing yet that we can do to restore that bright light of the eyes. You know, I was reading the Bible, and it said something about Moses died and the brightness in his eyes hadn't gone out. So maybe go to, you know, the foot of the mountain. And,
right.
You know,
maybe the answer is there.
That's the only way
Absolutely.
to keep that youthful eye spark.
Yeah, I mean, there are some things that just can't be turned back, is what it comes down to. Is like, and there is value in that. I mean, with age comes wisdom and hopefully experience, and that's okay too, right?
That's right.
We don't all have to look like we were 22.
Yeah, that's exactly right.
Do you ever tell a patient no?
A lot, yeah. Actually, I think one reason that I've gotten so busy so quickly is because I tell so many patients no. So they know I'm not here to make a lot of money. I'm an artist. I want to make you look great. So they know I'm going to tell them no if I don't think they need anything. I do a lot of rhinoplasty, and I turn a lot of potential rhinoplasties away, because if someone looks good and they have their nose wasn't done exactly right, but in general they're happy, they're breathing okay, and they look good, they're having a successful social life, I see no reason to try and make them look perfect. Some of my mentors that I really looked up to, every single one of them had the same saying: perfect is the enemy of good. So yeah, I say no a lot.
Yeah, yeah. When you think about rhinoplasties, do people come in with pictures and say, I want so-and-so's nose?
They do,
or
yeah.
They do, really?
Yeah.
Is that good or bad?
It's actually great, because it lets me see what kind of dorsum they want. So the dorsum is this part of the nose, and your profile is very important. When you're looking at someone, typically you see them straight on or from what we call an oblique view. The profile is what people see in pictures, and so they really focus on that, and that's great because it's easy to get a nice dorsum. But when a patient comes in, I take a look at what do they like. Do they like a little bit more of a stylistic nose, almost like a ski slope with the tip projecting out a little bit, or do they like the straight dorsum? So that lets me know, what does this patient want? What kind of nose do they want? And what I've noticed is that the stylized nose is coming back into vogue. It was popular back in the day. It kind of went away, and I'm really seeing where the stylized nose with a little bit more of a tip projection is becoming popular. My buddy Ash Gavami, he's the busiest rhinoplasty surgeon in LA. He is a phenomenal surgeon, and he and I were talking about this the other day, and we both agree that it's coming back into vogue.
Why do you think that is?
I think that with so much access to social media and entertainment, people are seeing more and more noses like that. So a lot of patients in Los Angeles are getting that look, and I think that that's kind of the seat of entertainment, and so it's kind of spreading across the country.
Sure. If you're considering any kind of plastic surgery, any kind of skin care, filler, whatever, what should you be asking the doctor sitting across from you before you do anything?
So the most important thing is make sure they're board certified, and make sure they're board certified in plastic surgery. There are people who call themselves cosmetic surgeons, and they're not qualified to do what they're doing. So you want to make sure that you have a board certified plastic surgeon if you're considering plastic surgery. If you're looking for a dermatologist, make sure they're a board certified dermatologist. There's one area in surgery that I think that you can go to a non-plastic surgeon, and that's vaginal rejuvenation. There are some board-certified OBGYNs who are dedicating their practice to that. I think that they do a phenomenal job, but you really got to research your doctor. Don't just do a Google search and see who comes up first. Ask your friends, go onto all the websites, and really do your homework. The beauty industry is so advanced now that people can buy likes, they can buy good reviews on Real Self and Google. So word of mouth is still the best way to find out what's going on. Just get a feel for your doctor, see how much they've done, ask them before and afters, ask them how often they do something.
But I find it's hard when not a lot of people want to fess up to plastic surgery. So when you're trying to find out who's the best, who can I trust, not a lot of people want to name drop.
Yeah, and be honest with your plastic surgeon. I can't tell you how many people come to me and they say, I haven't had plastic surgery, and come on.
You know.
I mean, we know. We see it all the time. So, but be honest, because if your plastic surgeon is in a rush and they miss that you've had something, they might not realize that your septum doesn't have cartilage for a graft. They might not realize that, you have a scar there, that you've had surgery there, that flap has been undermined. So you really got to be honest with your doctor. Don't hide it from us.
Yeah, because it's only going to hurt you,
yeah,
right?
That's right.
mean, in the long run.
Yeah.
Okay, very good. We have a really cool segment coming up. We're going to talk to one of your patients live and on the air, right? You want to set it up just a little bit?
Yeah, so this patient, she is an amazing patient, followed all my instructions, did everything right, and she got a great result because of that.
Yeah.
And she's just a beautiful person inside and out, and I'm excited that she's coming to talk to
all of us about her results. Yeah. Well, that's a great tease. Okay, so now you know what's coming up after the break, and still we are taking your phone calls. If you have a question for the doctor, go ahead and give us a call. We'll get that lined up during the break. 615-737-PLUS is the number to call.
Hi, I'm Kevin Kennedy with the Kennedy Law Firm, and if you've been injured, you need someone to go to court with you. We are honored to stand up beside you and to stand up for you. Call the Kennedy Law Firm, 931-645-9900.
Staying healthy is on everyone's mind. Dr. Sean Pruitt has spent his career in medicine, dispensing expert advice and helping patients get on the road to recovery. Now Dr. Pruitt is here to help you. Introducing Pharmacist on Call on News Channel 5+. Don't miss your chance to get free advice. Watch Pharmacist on Call with Dr. Sean Pruitt the second Thursday of every month at 7 p.m. on News Channel 5+.
Whether a house is new or whether a house is 20 years old, we can go in and we can find debris in the lines. Mr. B's is about doing duct cleaning the best that we can do it and better than anybody else in the industry. That's what I personally stand behind and guarantee. We never make a claim that we're going to help your health. That's just something we don't do. But again, I personally believe that if I put you in a cleaner environment, it's got to have a positive impact on you. And we literally cut a hole into the main trunk line. That's the main artery, just like a tree trunk. And we attach a HEPA vacuum system to it.
All right.
When we do that and turn it on, it causes a negative airflow. As that machine's sucking everything backwards, we go to each line and we'll brush it, and then we air sweep it down to the trunk line. So we've taken everything back to that negative airflow. So again, whether it's upstairs or downstairs, you saw that everything is being brushed and air swept to the trunk line, not bringing it back into your breathing atmosphere. What makes my home need an air duct cleaning? You have to make that decision. It's your environment. And so if you have black lines at the edge of your carpets, or you have any sort of dust, excess dust in your home that you're dealing with, and that's a problem for you, then you definitely would want your air ducts cleaned. But most people understand, too, that if they'll just look down the return, take the filter out a little bit and look down the return, they'll see all the dust that they're breathing on an everyday basis. The way we do the cleaning, most residential homes will be good for 5 to 7 years. We do recommend that you have your system serviced by a licensed contractor and also use a good filter. We've been doing this for over 17 years now. We take pride in the fact that we have an A+ rating at the Better Business Bureau. Also the fact that we don't believe that anybody's going to out-clean us. And as I've said before, people can outprice me, but they're not going to out-clean me. There's only one way, and that's the right way, and that's what we do at Mr. B's Air Duct Cleaning.
Hi, I'm Kevin Kennedy, and if you've been seriously injured in a tractor-trailer accident, you need representation that you can have faith in. You need the Kennedy Law Firm. That's 931-645-9900. Call us today.
Welcome back to Medical Monday. It's not often that we have live testimonials from patients here on this show, so this is pretty exciting. If you're just joining us, if you haven't been with us all hour, we're talking about plastic surgery, particularly facial plastic surgery, both the big-time surgeries and the non-invasive ones. Dr. Dan Hatef is our guest. Thank you for being here once again. And we also have Lori here, one of your patients. Laura, thank you for joining us.
It's my pleasure to be here.
You had a facelift about a year ago.
I did.
You look amazing. Tell me what brought you to the decision to do that.
Well, I thought about it about the time I turned 60. Mm-hmm. I'm 63 now, and my daughter said, why? If it's not broke, don't fix it. But, I was like, I know I'm going to want to turn back the clock at some point, and I'd rather do it sooner than later when it's not quite so obvious. I don't want to wait till I'm 70 to look 55. I want to look 50 when I'm 60. So,
are you happy with the results?
Oh, my goodness. Are you kidding me?
How long did it take you to really say, whoa, that's exactly what I was wanting?
Oh, not long at all. I was traveling 8 days after I had the work done. I just used a little bit of concealer, and a few months later, I mean, I could tell, you know, after a few weeks that it was better than I ever would have dreamt.
Oh, really?
It didn't look like I'd had anything done. I just looked like a more youthful version of myself. And
she really followed post-op instruction, took the arnica, used some pressure garments, did everything by the book, and that's really contributed to her healing okay.
So tell me about your process in this. What went into the facelift? What happens during a facelift? I know you get that question. See, I even asked it during a commercial break.
Yeah, sure. So when someone comes into my office, obviously I analyze their skin, you know, superficial to deep, and I had her bring in pictures of when she was younger. And Laura used to be a model, so she had a lot of great pictures, and I could really see her facial structure. And when I compared pictures of her when she was young to the way that she looked when she was 60, she looked almost identical. Her face just didn't have that youthful tension. So once you get to about 50, 55, it gets tougher and tougher to restore that look just with fillers. So I talked to her about just doing it with fillers, but we both agreed that she needed to undergo a facelift. I've had the pleasure to train under some of the most amazing facelift surgeons in both Dallas and Houston, and the guys who get the best results do something called a SMAS facelift. They manipulate the deep layer of fascia under the skin. So you have skin, fat, and then fascia. And the SMAS layer invests the facial nerve. So it's a little bit risky to go down there and to elevate it, but I know the anatomy so well that it's not really a big deal. Release that, move it into a more youthful position, and really get an idea of how much the patient needs, because the more you tighten, the more they can look pulled, and the more tension the flap is under, so it can come down. So you have to do it just right, just under the right amount of tension. Laura moved it up a little bit. She looked great. We talked about what her goals were before. She didn't want to look too pulled. She wanted a good correction of that youthful tension. She wanted her neck corrected. So I pulled her platysma muscle back. Also did liposuction and did fat grafting to the face. Fat grafting is a great adjunct to facelift surgery because you can restore that volume that's lost, helps with that youthful tension, especially in these areas that we have a little bit more trouble undermining. But not only does it do something surgically and volumize you, the stem cells that the fat brings in, they have to do something to that fascial architecture that I was describing for. They have to do something to the dermis because the skin glows like nothing else that we do besides maybe an invasive laser. It's really, fat grafting is a great adjunct. And I did fat grafting in Laura all throughout her cheeks, her chin, her temples, her forehead. We did her eyelids, really conservative with the eyelids, but still took some excess skin and moved the muscle around a little bit. Another thing that I did more that I do in a lot of patients is an upper lip lift. So a lot of patients will come to me and they say, "Oh, I had a bad facelift." When I look at them, I tell them, "You didn't have a bad facelift. Your facelift is actually very good. It's that your lips weren't corrected, so you don't have the upper tooth show." Like if you look at your smile, even in repose when you're not saying anything, you can see a good 3 millimeters of your upper teeth. So that tells the brain youth. So if you have a youthful tension here, but you can't see your upper teeth,
it gives it away.
Yeah, it gives it away, and it gives that bizarre, disharmonious look. So I do that a lot, and I do that in her. It's subtle, but it's really lets the brain think, what was done here? Keep them guessing.
Yeah, that is probably the big thing with plastic surgery. Just keep people guessing. You don't want to walk into a room and say, "Oh, she had something done."
Yeah,
right? Let's see some of these before and after pictures. I love pictures. So let's see the before picture of Laura, and like magic. Okay, now this was a while ago.
That was last year. That was about 40 years ago.
You're stunning. And this was how old?
That was just a little over a year ago.
Wow. Fantastic. Yes.
So,
yes, absolutely.
But I was starting to get this, and I had several chins, and things were just going south. And I just wanted to correct it before, like I said, before it became obvious that I'd had the work done. And I didn't want to be overcorrected. I didn't want to look like somebody who'd had a facelift. I just wanted a more, a more youthful version of myself, and I wanted to kind of kick it back a little bit.
Sure. Now, besides how you look and seeing yourself differently in the mirror, has it changed any other part of your life?
Well, I'm not really I don't consider myself a vain person, but I have two incredibly beautiful daughters. And when I was their age, I saw my mom kind of let herself go, started to gain the weight. And her face was, and I knew that if I didn't take care of myself, that would happen to me too. And I wanted people to look at me and look at my daughters and go, well, no wonder. That's where they get it.
Yes, absolutely.
If I'd continued on the path I was heading down, that wouldn't be the case. But I want to look like their mom, and I want to feel the best I can about myself. And
how'd you find Dr. Hatef?
Through friends.
Yeah.
I'd asked questions. I'd asked people I knew, and one friend in particular who I trust with my life told me that she had known several of his patients, and they were willing to talk to me and recommended him very highly. And when I met him, I knew he was the one.
You just felt comfortable?
Oh, yes. And everybody I know they're lining up now.
That's going to make you feel good. That's what you
They're all lining up.
Yeah.
They're my daughter's in line. She's like, Mom, this is great. I don't have to do any research. I know exactly where I'm going when I need it.
You can always trust Mom.
Yeah.
That's for sure.
Yeah.
I can ask you too. We've talked a lot about when people come to you and they want something. They want to look more youthful. They want something done for the first time. But what about fixing things? Or do you see a lot of that as well?
I do, yes. So I see a lot of patients with sometimes botched results. Sometimes they weren't prepared appropriately for surgery. So like I said, I say no to probably half the patients that come in the door. And of that half, more of them than not really have a pretty good result. But they just weren't, surgeons, we get busy. I mean, we're always late, notoriously. We're always doing something.
Notoriously. What time is it?
So sometimes we don't take the time that we need to educate patients. Here's what to expect afterwards. And so sometimes I think expectations are a little unrealistic. A lot of the times with social media and Hollywood in our faces, we don't have a realistic view of what plastic surgery results are like, because you see someone who's had a facelift like Kris Jenner. She had Garth Fisher, one of the best facelift surgeons in the world, but she's also hair and makeup, professional lighting. I mean, she looks her best. So you kind of get this unrealistic viewpoint of what your results should look like. So oftentimes I tell patients, I think he did a great job. It's just you didn't realize you were going to have this little crease here or this here. And there's stuff we can do to help, and I'm happy to do that. But oftentimes they go back to their plastic surgeon and just, I'm happy to let a patient just kind of be better educated on the back end.
Yeah. Okay. Very good. Laura, thank you for sharing your story.
It was my pleasure.
You look great.
Thank you so much. Well, thanks to him.
I can tell you feel pretty good.
He's the best.
That's awesome.
Yeah.
All right, we're going to take a quick break. When we come back, we will wrap things up. I promise you we'll give you the number to call if you want to talk to Dr. Hatef, and also an email address, so get your pen and paper ready. We're coming right back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
From News Channel 5, I'm Storm 5 meteorologist Henry Rothenberg. A few light showers as we go through the evening, but nothing that'll be problematic out there. The real threat coming after midnight and will be with us for the Tuesday morning commute in the form of some heavy showers and thunderstorms with a pretty strong cold front heading this way. You're looking at temperatures all across the region, and you can see that colder air. If you look to your left on the screen, you have got that colder air sliding this way, Arctic air that is, that's going to hang around for quite some time. Here are the current conditions out at the airport. This is updated every hour. For the forecast for tonight, 53. Now 55 will be the high on Tuesday, but that is going to be at midnight. Temperatures will fall as this front pushes through, and by Tuesday afternoon will only be in the 40s, staying cold for much of the upcoming week, with highs in the upper 30s to around 40 and lows in the 20s and teens.
This week on Fishin' Affliction TV.
Oh my goodness, what a fish. That's a killer fish right there.
Join Team Fishin' Affliction as they're on American Sport Fish's secret lake trying to catch a tiger by the tail.
That's a tiger bass right there, and a good one. Man, a good one.
Your Fishin' Affliction TV weekend begins Saturdays right here on News Channel 5 Plus, your home for
Fishin' Affliction time for those who've got it bad.
Do you see it? There's something going on.
All new Ellen, the stars of Jurassic World, Chris Pratt and Bryce Dallas Howard.
Oh, you got away from the dinosaur.
Only Ellen has a sneak peek for the new trailer, Jurassic World. And day 10 of Ellen's 12 days will leave you saying,
Where are we going? Will I like it?
Tomorrow at 3 on News Channel 5.
Welcome back to Medical Monday, talking to Dr. Dan Hatef about plastic surgery, non-invasive, and the whole shebang when it comes to the facelift as well. But I want to remind people, you do more than just faces.
I do, yeah. Like I said before, I do a lot of breast cancer reconstruction, obviously a lot of cosmetic breast surgery. Just as a plastic surgeon in Nashville, you're going to do a lot. Really, one of the most challenging but also most rewarding aspects of my practice is breast cancer reconstruction, partially working with Dr. Whitworth. He's just such a great world-renowned breast cancer surgeon, always pushing the envelope, always helping me to try and figure out how to make results better, how to make patients happier, and so I do a lot of breast and body, a lot of liposuction.
If someone gives you a call, because we're going to put up that number here real quick, what can they expect from the get-go?
Just ask to talk to Mandy. Expect to wait a while because we're really busy. So, you know, if it takes us a while to call you back, just be patient. We'll get back to you.
Okay, fantastic. Let's get that number out. Here's the number to call. This will get you to the Advanced Health folks and say, I want to talk to Dr. Dan Hatef. He was on about plastic surgery on News Channel 5. They will direct you to him, and they will get you in to see him. So here's the number and also a web address and an email, but I'll read the number to you. 615-986-6033 is the number to call. One more time, 615-986-6033. Thanks for spending the last hour with us.
Thank you so much, Carrie. I appreciate it.
Yeah, it's been fun. I've learned a lot. Laura, thank you for sharing your story.
It's my pleasure. And if anybody calls and wants and talks to Mandy and wants to talk to me, I'd be happy to talk to them too.
That's very sweet. Thank you.
It'd be my pleasure to let them know what great hands they're in.
Thank you, guys. All right, well, have a fantastic night.
Thank you.
All right, nice to meet you.
You too. Appreciate it.
Thank you all for joining us tonight. Have a great night yourselves. We'll see you back here next Monday.
Medicare open enrollment